Welcome to ophthalmology class. Today we'll discuss about rest of the bacterial conjunctivitis. They are chronic bacterial conjunctivitis and angular bacterial conjunctivitis. Bacterial conjunctivitis is a type of infective conjunctivitis. Bacterial conjunctivitis is of four types according to the clinical presentation. They are acute bacterial conjunctivitis, hyperacute bacterial conjunctivitis, chronic bacterial conjunctivitis, and angular bacterial conjunctivitis. We already discussed about the other two. They are acute bacterial conjunctivitis and hyperacute bacterial conjunctivitis. Now we will go to the next type, that is chronic bacterial conjunctivitis. Chronic bacterial conjunctivitis is also known as chronic catarrhal conjunctivitis or simple chronic conjunctivitis. Chronic bacterial conjunctivitis is characterized by mild catarrhal inflammation of the conjunctiva. Etiology of chronic bacterial conjunctivitis include predisposing factors, causative organism, and source and mode of infection. The first one is predisposing factors. In that, chronic exposure to dust, smoke, and chemical irritants is a predisposing factor. Local cause of irritation such as trichiasis, concretions, foreign body, and seborrheic scales. Eye strain due to refractive errors, phorias or convergent insufficiency, abuse of alcohol, insomnia, and metabolic disorders are included under predisposing factors. Next is causative organisms. Causative organisms are Staphylococcus aureus, gram-negative rods such as Proteus mirabilis, Klebsiella pneumonia, Escherichia coli, and Moraxella lacunata. Among these, Staphylococcus aureus is the commonest cause of chronic bacterial conjunctivitis. Source and mode of infection. Chronic bacterial conjunctivitis may occur as continuation of acute mucopurulent conjunctivitis when untreated or partially treated, as chronic infection from associated chronic dacrocystitis, chronic rhinitis, or chronic upper respiratory catarrh, as a mild exogenous infection which results from direct contact, airborne, or material transfer of infection. Next is clinical features of chronic bacterial conjunctivitis. Symptoms include burning and grittiness in the eyes, especially in the evening, mild chronic redness in the eyes, feeling of heat and dryness on the lid margins, difficulty in keeping the eye open, mild mucoid discharge, especially in the canthi, watering off and on is often a complaint, feeling of sleepiness and tiredness in the eyes. The signs of chronic bacterial conjunctivitis are grossly the eyes look normal, but careful examination may reveal following signs: congestion of posterior conjunctival vessels, mild papillary hypertrophy of the palpebral conjunctiva, sticky look of surface of the conjunctiva, lid margins may be congested. Treatment of chronic bacterial conjunctivitis are: first one, to eliminate predisposing factors when associated. Second, other medicinal treatment should be given. Then eye drops should be used. The fourth and the last type, angular bacterial conjunctivitis. It's a type of chronic conjunctivitis characterized by mild grade inflammation confined to the conjunctiva and the lid margins near the angles, hence the name angular conjunctivitis. It is associated with maceration of the surrounding skin. Etiology. First one, predisposing factors which are same as simple chronic conjunctivitis. The causative organisms of angular conjunctivitis are Moraxella axenfeld. It is the commonest causative organism. Moraxella axenfeld bacilli are placed end to end. So the disease is also called as diplobacillary conjunctivitis. Rarely, staphylococcal may also cause angular conjunctivitis. Source of infection is usually nasal cavity. Mode of infection. Infection is transmitted from the nasal cavity to eyes by contaminated fingers or handkerchief. Pathology. The causative organism, that is Moraxilla bacillus, produces a proteolytic enzyme which acts by macerating the epithelium. This proteolytic enzyme collects at the angles by the action of tears and thus macerates the epithelium of the conjunctiva, lid margin, and the skin. As it collects at the angles, the surrounding angular area of the eye is affected, hence the name angular conjunctivitis. The maceration is followed by vascular and cellular response in the form of mild grade chronic inflammation. Skin may show eczematous changes. Clinical features. Symptoms: irritation, burning sensation, and feeling of discomfort in the eyes. History of collection of dirty white foamy discharge at the angles. Redness in the angles of eyes. These are the symptoms of angular conjunctivitis. Signs of angular conjunctivitis are hyperemia of bulbar conjunctiva near the canthi, hyperemia of lid margins near the angles, excoriation of the skin around the angles, foamy mucopurulent discharge at the angles is usually present. Complications include blepharitis and shallow marginal catarrhal corneal ulceration. Treatment of angular bacterial conjunctivitis. Prophylaxis includes treatment of associated nasal infection and good personal hygiene. Curative treatment consists of medicinal therapy. Hope you all understood about bacterial conjunctivitis. Go through the portions, be thorough with it. Thank you for listening. Take care. Bye bye.